We'll move on now to our next speaker, who's Dr. Margaret O Sullivan. Margaret is a specialist in public health medicine with the Department of Public Health and HSE South. Her health protection brief includes the surveillance of and control of infectious disease, and her specialist interests include foodborne infections, waterborne infections, and a One Health approach to tackling zoonotic disease and antimicrobial resistance. She's the chair of the National Zoonoses Committee, a member of the National Interdepartmental Group on AMR, and she served on the Faculty of Public Health Medicine of Ireland and the Veterinary Council of Ireland, where I'm told by one of our colleagues in the council that she was always a rock of sense and very constructive. She's been a past member of the Food Safety Authority of Ireland Scientific Committee, and I know our colleagues in veterinary public health were very grateful to her input in dealing with the early outbreaks of COVID in meat plants, where the situation was evolving. And I suppose we cannot say we know it all about COVID yet, but certainly we know a lot more now than we did when the thing was evolving first. And as I said, our veterinary public health colleagues were very grateful for her assistance. So what we've asked Margaret to talk about is the One Health situation in Ireland, the zoonotic situation in Ireland at the moment. So with that, I'll hand over to you, Margaret.
So I've been asked to talk about zoonoses, the current situation in Ireland, and I think I'm suffering from a little bit of brain fog. I was saying to my colleagues here a while ago before we started. I've COVIDitis definitely since early last year. It's been hammer and tongs, but I do agree with Helen and her observations about the expertise in One Health side, and it's something I've always promoted. So it's an extraordinary time, the pandemic we find ourselves in, and you know the origin of this virus, and whether it was the Wuhan market or the lab or the whatever. I suppose the WHO has said that transmission from bats, most likely from via another animal, is most likely source. But whatever. This is so highly transmissible between people that it has made phenomenal impact. The picture there of the Irish situation was taken in early November. We've galloped on since then to higher numbers, and it's a very, very efficient spreader, this zoonotic virus, but I'm not counting that in tonight's presentation. So essentially, I suppose we're working on the preventive side, the mitigation measures, and we have very high vaccination uptake among our population. All of the mitigation measures really are to try to address what this virus is throwing at us, this very efficient virus, but I suppose ultimately to try to keep people out of hospital or becoming very ill and taking beds that are needed for so much more care. So I'm going to talk about zoonoses in general, the overview from the Irish situation, some of our more common zoonoses, some of the preventive aspects, and of course emphasising the One Health approach. You've been through this, transmissible between animals and people, whether it's by direct contact with the animals themselves, by vectors, mosquitoes or mites, infected food, contaminated water, or in the environment. So many sources, and of course, as I say, when we had efficient transmission then between people of the virus that's picked up from animals, that's when we really have an awful lot of trouble as well. So it's a complex interdependent coexistence, whether it's companion animals, production animals, wild animals, through food, through our livelihoods, or through well-being that we're in contact with animals, and of course the shared environment. And Virchow, who was a German physician, pathologist, coined the term zoonoses and said between human and animal medicine there are no dividing lines, nor should there be. Okay, so you've seen this already as well. 60% of existing human infectious diseases are zoonotic. 75% of our emerging diseases of humans are zoonotic, at least, and 5 new human cases every year. appear that are 3 of which are from animal origin. I won't talk about the bioterrorism. So just some of the zoonotic diseases that we're well aware of, but a lot of exotics that Helen knows a lot about. The chikungunyas, the Marburg, the Rift Valley fever, all of these ones that thankfully we don't experience here, and various sources, be they monkeys, camels, bats again there, whatever, wild birds, but there's no shortage. So in 2020 in Ireland, these were sort of the most common zoonoses that we had here. Campylobacter leading the posse at about 2,500 cases. VTech or STech, which I will spend probably most time on at 826 cases. Cryptosporidium 512, Salmonellosis just over 200, and then Giardiasis, which 163 there, and then much lesser numbers of Toxoplasmosis and Lepto and that. So I'm just going to go through briefly at Campylobacter, and it's our most common cause of bacterial gastroenteritis. And looking from 2004 onwards there in the upper fig, just see the numbers that we have, the rate per 100,000. We have high rates. The main risk factors would be from handling raw poultry and eating undercooked poultry meat, contaminated water, and underpasteurized milk. It seems it's hard to get surveillance on this as regards how sporadic the picture is with regard to cases, or do we have many clusters? We need further research to understand key exposures with regard to Campylobacter. Mainly affects young children, and we see this with a lot of these zoonotic gastroenteritis, that it's young children that would predominate really in the cases. And our Campylobacter numbers would be highest sort of mid-year every year. That's the way it goes. There's a lot of work being done on the poultry industry for quite a while, and you veterinary colleagues would know, and farmers would know a lot more about that than I do. But there's a lot of ongoing work there, and it's as I say, it's continuing. The Cryptosporidium, this protozoal parasite causing diarrhea in people and in animals, with both human and animal reservoirs living in the guts of both humans and animals, but different species. But the spread is basically, it's to try to get the public to understand that you swallow. It's the fecal-oral spread is you have to get, it's the feces from, in some shape or form, from the animal, will make its way to the human mouth, whether through not hand washing, through with direct contact with the animal or the farm environment, contaminated water, contaminated food. That message just doesn't seem to, it's hard to, it's a simple one, and it's just a hard one to get through to people. The importance of hand washing before putting hand to mouth or before eating. So we have got about 300 to 600 cases notified every year of Cryptosporidium. There's a spring peak. It's more common rurally, up to 1/3, and it's a lot of hospitalizations. About 1/3 are hospitalized, and it's mostly children under 5. They're mostly, it seems, sporadic cases. We don't see many outbreaks. When we do, we can see fairly big ones. There was one back in 2007 affecting the Galway municipal water supply, with hundreds of people ill. That was really the human crypto species, but there were some animal, I think, ones found in it as well. The spring peak is shown there. That's consistent every year in cases, so March, April, May. And the main risk factors are animal contact, living on a farm or visiting farms especially. Springtime peaks correspond to peak lambing and calving season. And as I say, there's an urban-rural divide here. We don't see many cases, actually, proportionately, of Cryptosporidium in people residing in the east of the country, in the Dublin, the greater Dublin area. It's very much more a rural phenomenon. And water from private supplies, contaminated water from private supplies, we see, you know, a good proportion of cases that we suspect would be linked there. And I'm going to talk about private water supplies in connection with VTech, because it's something that really needs a lot of attention. That's just the economic impact really of the Galway outbreak, where there was human and animal waste found in the Galway water, but it was found that it was mostly due to the human waste. And of course, boil water notices can persist for quite a long time as a result of crypto contamination of water. Salmonella, in 2020 we had 219 cases, 355 in 2019 and 363 2018. And the Health Protection Surveillance Centre haven't a lot of their figs updated yet, because they're just you know, busy with other things COVID related. But just the data would be much the same, in the sense that about a third, going back to 2018 data, about a third of people would be hospitalised with Salmonella. It's a really can be really nasty infection. But what we're seeing is that, you know, certainly 50% and over are seem to be associated with international travel. The most common serotypes we see here are enteritis and typhimurium, but enteritis is the most prevalent among cases that acquire their infection in Ireland. There's increasing evidence of Salmonella enteritis, both travel associated and domestically acquired, but you know, a lot of it is travel associated, so acquired abroad. Our Salmonella notifications peak mid-year again, but not as obviously as crypto, and it extends to September, but that's fairly consistent each year as well. So foods remain an important transmission route. Eggs and egg products we've seen in a lot of, well, a certain number of outbreaks at a European level, and various meat and meat products. Also contact with pets, like reptiles. We've had issues with that in the past. Pet food, wildlife and cattle. The majority of cases diagnosed in Ireland seem to be unrelated when we look at whole genome sequencing. Any case clusters and sporadic cases, we've recognised in some instances some of the sporadic cases have been part of larger pan-Europe incidents, and also some of the case clusters we have. But we don't, thankfully, see much in the line of Salmonella outbreaks. And indeed, the incidence of Salmonella as regards being acquired in Ireland has seen a dramatic change compared to decades ago. So, but we have had, you know, we have had deaths. We had in 2018, we had a young mum who contracted during a communion meal Salmonella. We've had the infant milk formula side is a concern when there were any issues there, and especially the fact that we have such a big industry here with regard to infant milk formula. And reptiles, Helen mentioned reptiles as well, and we certainly saw that going back along, maybe not so much of late, but certainly we did highlight that situation going back and communicated it to the public, and it seems to have, we certainly don't seem to see as much of salmonellosis contracted from reptile pets kept in the homes. So VTech, Virocytotoxin producing E. coli, or Shiga toxin producing E. coli, and the poor ruminant animals getting a hard hit with it. They're healthy carriers of it, and so that's difficult for farmers really when it's not that these aren't unhealthy animals that are the issue. High notification rates in Ireland, very high. We've had the highest in Europe for many years. In 2020, our rate was 17.3 per 100,000. And you can see there that you know, they're staying up, and they've gone up. They've grown so much really from say the early 2000s. But really, there's been change in testing practices as well in labs, and some of that was reflected in 2011. you can see the dramatic jump there, but there has been a real increase as well. So in 2020 we had 826 cases. And we do see there mid-year again kind of a peak pushing into mid and September kind of time. Children are the huge, account for huge case numbers with regards to VTEC. Our serogroups there, you can see it's 0157, the pink and red there underneath the 0157 and 026. 026 has been leading the postate there for a while. And I suppose we're finding a whole plethora of other serogroups as well now with VTEC. So the hemolytic uremic syndrome side, I suppose, is a particular issue with regard to children, especially. But 5 to 10% of cases internationally of VTEC end up with hemolytic uremic syndrome. And as I say, it's mostly children here. And we had 40 cases of hemolytic uremic syndrome in 2018. Comes with the issues of sort of kidney issues, coming up in kidney failure and occasional deaths. Thankfully that hasn't been the case for a long time, but it's a big issue, and we do have high number of this. And it's mainly 0157 and 026 we see that end up with HUS, but it's really the STX2 is most usually associated with hemolytic uremic syndrome, circled there in the middle up on top. So VTEC has huge outbreak potential. We've seen it in other countries, some huge outbreaks, particularly if they're related to water, where they can, if it gets into a municipal water supply, and there's a breakdown of the chlorination system or whatever, it can result in huge numbers. But it's been seen with regard to food and other aspects internationally. Lettuces there you can see in the bottom right, infected chopped lettuces. But the outbreaks in Ireland are mostly family outbreaks. About 80% of them, they're small family outbreaks. The main transmission routes are once one person gets it, the person-to-person transmission, it might happen between a child and an adult in a home. It's the most common transmission route, but where we see that mostly happening is in childcare facilities, and that causes a huge amount of work for departments of public health across the country, childcare facilities and VTEC. Once it gets in there, because of the way the children play, close contact, hands to mouths, it can spread quite easily. Contaminated drinking water is particularly private wells, and I'll just mention that again. Animal and environmental contact food containing raw milk products and undercooked burgers, there are other sources. But here in Ireland, I'll come back to the main sources there again. As I say, our childcare facility outbreaks are a huge worry. Every year we have a plethora of them across the country, and we often end up with 10, 12, 14 and more cases in them, and frequently a child or two hospitalized. Waterborne outbreaks associated with VTEC in Ireland. Looking at the data between 2004 and 2017, there were 113 outbreaks, which were mostly small family outbreaks, but the majority of them were linked to their private wells. I did a paper back there quite a number of years ago now, but highlighting an increase in VTEC cases linked to private wells, because it wasn't a kind of a very much talked about feature then, but really since then there's been a lot more written on it, and it is very much a risk factor. The EPA have zoned in on it for over several years now. About 1 in 10 of the population are served by, of households are served by private wells. So there's an association with cattle density as well, VTEC, cattle density and private wells. And really the protection of wells is something that we try to communicate where we can, and this has been done extensively really in One Health mode, I would say, across the country over very much recent years, because it is a risk factor and a preventable risk factor. So with regard to VTEC animal contact outbreaks, which again over that 13 or 14 year period there was a lot of small outbreaks again, but You know, we've seen them with the livestock visiting schools, where there's kind of visiting, I don't know, calves or whatever, and children are allowed to pet them, and petting farms. That's where we're seeing other cases of VTEC. And we had a restaurant outbreak here in Cork in 2016 where we had 11 cases. I think there were 3 or 4 people there hospitalised, very unwell, undercooked pink burgers. So the burgers were, it was identified in the meat and in people, and identical, the identical bug. So person-to-person spread, waterborne transmission, and improperly managed private well supplies remain the most common transmission source for VTEC infection in Ireland. Toxoplasmosis, I was asked to mention briefly, this protozoal parasite with cats as the intermediate hosts and animals becoming infected from contaminated feed, and with cysts resulting in their muscles of animals and abortion in sheep. So people can be infected by contact with cat feces or contact with lambing ewes or eating undercooked meat. The notifications between 2015 and 2020, we've had an average of 28 cases every year from toxoplasmosis. Most people are asymptomatic, 10% have flu-like symptoms, and thankfully congenital cases or babies born with toxoplasmosis are not frequent. And between that 9-year period there, between 2010 2018 8-year period, there were 5 cases, but it's a pretty catastrophic diagnosis really. And you know, the message of pregnant women not and you know, sheep at lambing time to the care that's needed there is to be basically stay away is an important one. And I'm stuck again on that. So that's widely communicated around springtime of every year through various channels. Also exposure to cat litter and contaminated soil contaminated with cat feces. I was also asked to mention lepto. So the source, obviously rats or rat, cattle or dog urine or fetal fluids from cattle. And you know, where there's stagnant water, particularly or slow flowing water in ditches, ponds and riverbanks that can be contaminated with such urine. But also that obviously, as you know, cats, rats can contaminate animal feedstuffs on farms. So people pick it up through scratches or cuts, their hands particularly, or if they're splashed with maybe milking cows with cattle urine, the lining of their mouth, throat or eyes. So about 22 cases per year on average, and again a flu-like illness. Some can develop meningitis and occasionally Weil's disease with possible liver and kidney damage, and there can be a mortality rate as well with Weil's disease. Again, I was asked to mention brucellosis and bovine TB as well. Thankfully, these diseases are very rare in humans now. 2 cases in 2016, 2 in 2017, and we had none in 2018, 2019 or 2020 of brucellosis. And bovine TB between 2011 and 2019, we had an average of 5 human cases a year, and that would be just 1 to 3% of the total number of TB cases annually in humans. So they're great success stories, really, those zoonotic diseases in humans in this country. So, as I say, great progress with regard to obviously animal health and husbandry, with regard to the zoonoses that I've been speaking of, disease eradication schemes, various quality assurance schemes, Board BIA quality assurance schemes, vaccination programs, and poultry and industry initiatives, to mention but a few. There's an awful lot of work being done, a lot of great work being done by the farming/veterinary community. On our end, I suppose we're trying to analyse the data that comes in to see, you know, are there changing trends in these diseases and who's getting them, and where people geographically, where it's happening, who are the highest risk groups, is there any change in the way things are in what we're seeing. But really, coming back to public education, and I suppose this is the remit of One Health as well, to be communicating these messages. But hand washing, I suppose if I was to put any on top, it would be, but kids, I suppose, won't, certainly young children, and that's where we see, say, a lot of the VTECs and the Campylobacters. And as I say, the bug has to get into the mouth, and it's people not washing their hands before, as I say, animal contact or whatever. So before eating and before putting hands to face, if possible, it's a huge message, and maybe COVID has made it more obvious now as well. Cooking meat properly, washing and peeling raw vegetables. These would be just general messages with regards to, some of the more common zoonoses. Pasteurized milk and milk products, rather than just be careful, anybody that would be using unpasteurized milk or milk products. Safe drinking water, I can't emphasize that enough. And obviously the care that pregnant females need to take with springtime, particularly with lambing and calving time. So the future is, that has been mentioned as well by the Minister, and there's a lot of challenge ahead. And remember on the human side as well, we've much higher numbers of immunosuppressed people living on medication that wasn't there before, and helping their what the illnesses they're suffering with. So that would be maybe more prone to people infections as well. So it's one of the aspects to be mindful of. So many of the same microbes infect animals and people. We have the shared ecosystem, as Helen pointed out, and the efforts by just one sector aren't enough. And if COVID has pointed out anything, it's the importance of working together. Thanks very much, and sorry for taking over time.
Thanks very much, Margaret, and apologies for the technical difficulties. In fairness, you kept going through it, despite technology getting stuck on you, but well done for keeping going. And in fairness, that was a very interesting presentation, because we're not always aware. I think we're aware of these pathogens, but we're probably not aware of their prevalence and those risk factors you mentioned as well for those various pathogens. Again, it's all common sense, but we do need to be reminded from time to time.